This is an old video. Dr. Saladino went to the doctor's show and he was grilled. But just the level of disrespect, and I think even a lawyer was extremely rude. And there was a lack of open mind in hearing his point of view and the constant attacks and not allowing him to speak. Just disappointing on the lack of professionalism that they showed Dr. Saladino. Let's take a look at it.
Dr. Saladino, when you're recommending this diet, what risks do you discuss with your patients?
I don't think there are any risks to eating animal foods exclusively. There are no risks in terms of kidney function. There are many studies which show that high-protein diets do not affect kidney function. There are no studies interventionally that show that eating meat is going to increase the risk of any single cancer. There are no risks to eating the foods that we have been eating as humans for our entire existence.
As an attorney, I would ask you, you're a medical doctor, is that correct?
Absolutely.
And you are a psychiatrist, am I correct?
Right, a residency in psychiatry.
So what do you know about nutrition? Where did you gain your background in nutrition?
Listen, this is, I think...
No, you listen to me and answer my question. Now I'm...
As a professional, you want to take people's advice with a grain of salt if they don't have the credentials to display that. Clearly, this is a doctor, extremely bright, perhaps 3, 4, 5 years of higher education. She has her Juris Doctor degree. But she goes on the attack, on an attack of questioning the carnivore diet. She doesn't have the medical background, whereas Dr. Saladino does. I think he's a psychologist and also studied nutrition. So he has the credentials to claim that the carnivore diet is perhaps the best approach for the human diet, whereas the doctor doesn't carry as much weight. I mean, the lawyer doesn't really carry as much weight. Let's continue watching it.
I'm asking you to tell us where your background emanates from.
I went to medical school and I studied nutrition in medical school and I studied nutrition independently. One of the crazy things about medical school is that it teaches you how to read articles. I'm a doctor. I know how to read articles.
So have you done any independent testing? Have you written any articles that was as suggested by the physicians who've been here today?
What does writing articles have to do with my knowledge of
Well,
nutrition?
because I could become you. I could be you as an expert because I read all of the data and all of the articles on this subject. Now I'm an expert. That doesn't make me an expert.
With the proper background and with the medical training, medicine needs to think about teaching doctors more nutrition in medical school. But it is up to us to educate ourselves. Just because there's a degree that says a doctor doesn't mean that we have or don't have medical nutritional knowledge.
I like that statement that he made. It's up to us. I think it all comes down to the individual, doing the research, asking the right questions, listening. I think that plays a huge role. For years, perhaps even decades, I was consuming just the American diet: lunch, breakfast, dinner, processed food, carbs. Not the best choice to live a healthy, productive life. It wasn't until I started asking the right questions. How long have humans lived on this earth? In that process, how we were impacted by evolution, when it came to nutrition, our environment, our social structure, and ask the right questions. What should we be consuming? Why is it that, we develop crooked tooth and some people don't? How did the Industrial Revolution impacted our food consumption? How did the ag industry had an impact on the foods that we eat? All those questions were the right questions, and that led me to the journey of the carnivore diet. 7 weeks, I melted 18 pounds. Have much more energy, more focused, more dedicated. I think it's definitely the right diet most humans should adopt. Everyone's different. I understand that, but it's working for many people. Many people.
The bottom line is you practice psychiatry, am I correct?
I practice medicine.
You practice psychiatry, is that correct?
Medicine.
So what makes you an expert in this?
Because an expert in what? An expert in understanding human physiology? This is medicine. The separation of human into organ systems doesn't serve the patient. To say that because I'm a psychiatrist, I don't know about nutrition is a completely...
I didn't say that.
That's
your
what you were
expertise
inferring. That's
is
what
the
you were
mind.
inferring. Well, where does the inflammation come from that causes depression and anxiety? It comes from the body. It doesn't come from the brain.
It's a scary thought process that is all you need to do is read articles to make you an expert. I want to know what kind of testing you've done, what kind of data you have, what you yourself have found regarding these issues,
I'm not sure
other than what reliance is on other people's
I'm not sure I understand your question because that's how
You don't want to listen to my question because you know I'm right.
No, you're wrong.
When you talk about the animal diet,
Wait a second.
when you talk about
given the floor to respond to this isn't fair.
Okay.
Right? Anyone gathers data data by reading articles. Anyone gathers data by learning. What you're suggesting is not a fair criticism of me.
I'm a board-certified physician nutrition specialist. I have been practicing nutrition exclusively. I'm trained as an internist. I was originally board-certified in internal medicine. I have spent 20 years. You've been dallying in this for a few years, reading articles. I've been doing it, working with patients.
Again, he's just being under attack. Is the tone that he's receiving from the panel conducive to allow proper dialogue of exchanging ideas? I don't think so. I don't think the tone was necessary. Is that how they treat their guests? Just having a different opinion? He's under attack and he's outnumbered. Ridiculous.
My oath is first do no harm. And I am not a plant-based person. I don't advocate only plants. I think meat, I think there is nutrient density. I think getting rid of the processed foods and the toxins in processed foods, that's what's damaging the gut.
That meat is dangerous.
Show me the study that broccoli is dangerous to lupus.
Okay, wait. I will show you the study.
Can you please just provide the name of one reputable medical journal that supports the meat diet? That's what they are asking.
Right.
Thank you.
So in 1930, there was a study published in the British Medical Journal of a year-long investigation of 2 people in Bellevue Medical Hospital who were eating an exclusive carnivore diet. And during that period of time, these people experienced no negative effects, no dangerous changes in blood pressure, kidney function. They only experienced good things, a little bit of weight loss, and came out of the study saying that they felt better than when they started. So there have been prolonged, detailed studies of a full carnivore diet.
It's a one-year study from 1930.
Of 2 people.
Has there been anything since 1930 with more than 2 people?
There was a study at Harvard done looking at the carnivore diet with regard to gut flora. And so they put people on a carnivore diet for 1 week, and they looked at changes in gut flora.
Okay, that studies was for 1 year. I've been doing it for 7 weeks. So far, I've lost 18 pounds, have more energy, I'm more focused, I'm no longer tired, I'm able to be on the treadmill for 30, 45 minutes. The benefits, I've seen within 7 weeks. I can imagine after a year, what are the additional benefits I'm gonna receive from the carnivore diet.
And they didn't see any change in the microbiome in terms of alpha diversity. There was
1 week. Literally, there are thousands and thousands of studies that show the benefits of fruits, vegetables, nuts. And we're not saying meat's bad for you. I ate meat last night. But you keep getting back to, no one is saying meat is bad for you. What we are saying is, if all you eat for your whole life, ever, is just meat, that's not good. I don't have to be a doctor. I'm just I'm blown away right now.
He was under attack. They chose not to listen to his point of view. The rebuttals, there was no rebuttal. It was just an attack. The tone did not allow an environment of exchanging ideas. Look, if you want to improve your health, entering 2024, look into the carnivore diet. Do your own research. There's already hundreds of videos or perhaps thousands of videos on YouTube on people doing a carnivore diet and the benefits that they've seen within a short amount of time. So kudos to Dr. Saladino. He's a man of conviction. He went there, unaware perhaps that he was going to be under attack, but he's a good resource. All right, guys, have a good one.